The objective of this video is just to provide an overview of one of my papers entitled A Classic Surplus Shortage of Nurses in Indonesia. Well, nursing surplus shortage in Indonesia is not a new phenomenon, but this is still the case until today. Well, nursing surplus occurs when the number of nurses production is more than the need, but nursing shortage occurs when the demand of the nurses is more than the number of nurses productions. Indeed, looking at the number of the nurses in Indonesia is more than 100,000 produced every year. So that should not be the case for the nursing shortage in Indonesia, but it happens anyway. So what happens here? Unfortunately, the absorption of the domestic labor market in Indonesia is quite low. More than half of Indonesian nurses work in non-governmental sectors, and while some nurses may remain unemployed or take up a non-nursing job. And according to the Ministry of Manpower 2018 report, only 400,000 are employed from 600,000 job opportunities. So it means still more than 200,000 nurses are not working or looking for jobs. Although during the COVID-19 pandemic, many nurses were employed, but the ideal ratio has not yet been satisfied to absorb all available nurses. According to Ministry of Manpower, Indonesia needs an additional more than 500 hospitals to absorb all nurses. That's a really big number of the hospitals that we need. So what has the government done at this time apart from being required to add more hospitals? So there are 4 government policies that the government has done. First, of course, provide job opportunities, especially for the government employees or pegawai negeri sipil, or called PNS. Or another one is contract nurse or pegawai kontrak. So the hospitals need to provide more formations or job opportunities for nurses, but actually it's according to the government. The second one, the government has tried to reduce the admission quota of the students and suspending the substandard nursing program and withhold permissions to establish a new program. I can say this is the good one because nursing surplus is dependent on the number of nursing schools. Right now it's more than 100 nursing schools in Indonesia. So it's quite big numbers of the nursing schools to provide bachelor and diploma nursing programs. And the third one is about special assignment of team-based health workers to support Nusantara Sehat, or we call it Healthy Archipelago. This is to reduce unequal distribution of nurses. So this program is actually to send many nurses in all provinces in Indonesia. It is because the background for this, because many nurses don't want to work in the underserved areas or rural or remote areas. And another part of this program is actually to establish the new schools, especially in the remote and rural areas, because many nurse candidates would like to study nursing, but they don't want to go to the downtown, they don't want to go to, let's say in Jakarta, they just want to stay in their area. So establishing the new schools in their area will be beneficial for them, and also scholarship should be provided for them. So it's easy for them to study nursing, and then they directly apply for their own communities. That's the good one as well. And the fourth one is about encouraging Indonesian nurses to find jobs or develop careers abroad. Well, with the nursing surplus today, of course, we would like to encourage our nurses to work abroad. But still, another problem will happen is about the brain drain, right? The brain drain problems. But international migration of nurses is actually occurring since long time ago. Many nurses go to Saudi Arabia, Kuwait, Japan, Singapore, Malaysia, but it's just a little percentage of the nurses go abroad because Indonesian nurses, unlike Filipino nurses, so we are not exporting nurses yet, but we are working in progress. So there are still barriers about the international migration that I address a little bit in this paper. So what kind of the barriers related to the government policies that have been provided? First, many nursing schools are still continuing the substandard nursing program of their own accord and continue to increase the admission quota for nursing students so that the nursing surplus will continue. So this problem needs the strictfulness from the government. If substandard nursing study programs still available out there, many candidates come to these nursing schools, and then what happens? The standard nursing program is questionable, so the nurse competence will be questionable as well. So the role of the government is really needed here. And the second one, the government expects that all nurses can be absorbed in the labor market. The exceeding number of nurses today is just considered a temporary surplus. I do not really agree with this kind of statement actually, because the nursing surplus shortage occurs even before the era of ASEAN Economic Community. So this is not temporary. We do hope this is just only a temporary surplus, but we really expect that the job labor market can be improved. And I really appreciate those who are working to provide the information or even provide the job opportunities for nurses. And the third one, many nurses do not want to go overseas because of their family, language, competence, and other barriers. Actually, so many job opportunities are out there. But again, it's because of the family members and the language barrier, especially English or Japanese, Saudi Arabia language. So it's quite difficult to learn, right? And as well as the competence. Well, the competence is related to the fourth one. Well, it's because the national competency test today cannot be equated with the RN competency test, for example, like NCLEX program or Prometric test. We do hope that our competency test will be similar to NCLEX, so we don't need to take another competency test. While you graduate from your study, so you get only one time competency test and you can work anywhere in this world. It will be dream work, right? But it's not the case, because even with the national competency test, there are still many nurses do not pass the exam, and the exam is carried out 3 months after their graduation. So during 3 months, many nurses complain because they can't work in any hospitals or any healthcare facilities. So this is the homework for us to improve the competency system. So that's only the highlight about the current context of the nursing surplus shortage, the government policies and the barriers. So we do hope that we can do better for our nurses in the future. Thank you.